For the Vietnamese community in Orange County is the most densely populated for the Vietnamese. So some of the barriers we face are language, socioeconomics, the transportation. Those are just some, but those are the main barriers that could bring our community up to par as far as getting access to care.
Through the REACH project, we were able to work with different sectors in the community, with business, local government agencies, other community-based organizations, and media, which some sectors we never worked with, right? Businesses, nonprofit business, we don't do the same thing. But because of the shared vision and the commitment that we have towards making a healthier community, REACH was able to provide us the necessary tools and guidance to have these two interventions with the smoke-free outdoor intervention policy to create a healthier environment for Vietnamese American frequenting these plazas, but also helped us create a community clinical linkage e-refer system to refer patients to different organizations. Because of the REACH project and the e-refer system, we were able to serve over 2,000 clients.
So when we have the CCL, that provided a centralized portal of information, and all the services providers can kind of help them navigate through all that.
We don't provide direct services. We had to look at other agencies that provide it. With VACF, who provide cancer services, resources, and education outreach. If you walk through Vietnamese American Cancer Foundation's doors, they have pamphlets, information, and competent staff who knows the culture and the language to guide these patients to the right healthcare services.
We know that there are still inequities in Orange County. There are some groups that do smoke at higher rates. There are some groups that are more exposed to secondhand smoke, either at shopping centers or in their home. And so what we try and do is provide that assistance, that support to residents to help them avoid exposure to smoking, to provide free services to those who smoke to help them quit, and to prevent young people from picking up the habit because we know that it is very addictive. So it helps to have multiple organizations working together toward the same goal.
The reason why they intersect together is because a lot of the times you'll have these regulations that tell you, there's no smoking allowed, but the benefit of having a quit smoking service is that people who are in these environments where the regulations are enforced actually have a place that they could quit. They actually have services where they could get the help that they need instead of someone just telling them to stop smoking.
Especially with the language barrier and being culturally competent. The Vietnamese language hasn't caught up with the American language, especially in healthcare. It does take us some time to get across to our community. So training our staff and working with community members who are culturally competent helps us provide the needed resources and the appropriate resources to the community.
So the impact on what REACH had in the community, first and foremost, very impressive metrics that, as a team together we achieved, included 67 business plazas that were joined the SFO effort. Over 1,500 businesses were part of that as well. 190,000 people were reached in the community over the course of only 4 years.
Because of Getting Further Faster, we're able to take a look back at our REACH project and do a retrospective evaluation of it to see the successes and the challenges. With the technical assistance with Getting Further Faster and their evaluators, we're able to look at our data and use that to support our future work. Expanding our coalition, leveraging resources, they had us do a sustainability plan and a policy plan where how can we keep our partners and their buy-in, but also work together to find funding opportunities together to continue the work for the community.
We have so many other diverse communities here, and there's still a lot of people that are in need. And it's not just Orange County, but in our region, other counties, SoCal, all of California, and all of the US. So this one is a one model, but it definitely has a lot of potential to be expanded without limit, really.